Most veterans walk into a C&P exam with no idea what the maximum rating for their condition even is. They show up, answer some questions, and then wonder why they got 10% when 50 was sitting right there on the table. That ends today. We're going to go through this chart, 7 conditions, the max rating the VA will assign for each one, and what that pays per month and per year in 2026, and 1 C&P tip per condition. And we'll cover how the VA math actually works for these ratings and how they stack at the end of the video. I'm Jacob, an Army vet and now a veteran benefits specialist here at VetClaims.ai. Now here's what I need you to understand before we dig in. The difference between a veteran who knows these numbers and one who doesn't can be $2,000 a month or more. That's $24,000 a year walking out the door because nobody sat you down and showed you the battlefield. The chart runs like this. Max scheduler rating under 38 CFR, what that rating pays per month and per year in 2026 for a single veteran with no dependents. Here's what you also need to know. Most veterans never hit the max. That's not an accident. The rater is not connecting dots for you. It is up to you to connect the dots. Condition 1 is tinnitus. Diagnostic code 6260. The max rating is 10%. That's $180.42 a month in 2026. The ceiling and the floor are the same number. There is no 20%, no 30%, 10% is it, and you either get it or you don't. Here's the thing about tinnitus. It's subjective. Only you can hear it, which means your job at the exam is to describe the sound, the frequency, and the exact in-service event that caused it. Flight line, gun range, heavy equipment without hearing protection. Be specific because specific wins. Tinnitus alone is a small slice, right? But file it, win it, and it opens doors, and we'll come back to that. Condition number 2 is migraines under diagnostic code 8100. The max rating is 50%, and that's worth $1,132.90 a month. That's $13,594.80 a year in 2026. On average, however, veterans are only rated at 10%, which only equals around $180.42 per month, or $2,165.04 a year. The rating scale runs 0, 10, 30%, and 50%. And the word that separates them is prostrating. Prostrating means you are physically laid out, you can't function, and the attacks take you completely out of the fight. So for 10%, you'd have to have a prostrating migraine at least once every 2 months. The 30% would be a prostrating migraine at least once a month. And then the 50% is having those prostrating migraines with economic inadaptability. So if you have lost your job, you've called into work a bunch of times, you have a bad reputation at work and it's annoying your manager and your coworkers, you need to say that. Talk about how many days a month you call in or miss work due to your migraines. That's not a bad headache, that's a shutdown. Now look at the gap. 10% pays $180 per month, while 50% pays $1,132.90 a month. Same condition, same veteran, 4 times the money, all riding on how you describe your symptoms at the exam. Before you go in, keep a 30-day headache diary. Date, duration, frequency, and whether you had to lie down. The rater needs to see a documented pattern, not just listen to you describe one from memory. Now the next condition averages a 70% rating right out of the gate, and most veterans are still underselling it. Condition 3 is PTSD, or diagnostic code 9411. The max rating is 100%, worth $3,938.50 a month in 2026, as a single veteran with no dependents. The average rating is 70%, which pays $1,808.45. Sounds decent until you do the annual math. 70% is roughly $21,700 a year, while 100% is $47,262 a year. That gap is a mortgage payment sitting on the table. The VA rates PTSD on occupational and social impairment, how badly your symptoms wreck your ability to work, maintain relationships, and function. 10% means you have symptoms, but they're controlled basically by medications. 30% means you have occasional issues. 50 means reduced reliability, and 70 means deficiencies in most areas of your life. 100 means total impairment. Your job is to describe the full picture, not the best day you've had recently. The C&P exam is where 70% quietly becomes 50% for veterans who show up unprepared. Write down every symptom across every domain before you go: work, relationships, sleep, hygiene, impulse control, and panic attacks. If you don't say it, the rater can't rate it. Bring a buddy statement from someone who sees you daily. That's one of the most underused tools in this entire process. And your stressor must be documented. If you feared for your life, that clears the bar. Don't minimize it. Condition 4 is sleep apnea, or diagnostic code 6847. The true max is 100%, which requires a tracheostomy or chronic respiratory failure with CO2 retention. That pays $3,938.58 a month. But the realistic target most veterans fight for and win is 50%, which kicks in the moment a CPAP is prescribed. That's $1,132.90 a month. Now here's your 2026 warning. Proposed VA changes would eliminate the automatic 50% for CPAP use alone. Under the new framework, you need documented functional impairment, not just a prescription. These changes aren't final yet, but the direction is clear. Get your claim filed now and get your records airtight before the rules shift under your feet. At the C&P exam, bring your sleep study and your CPAP prescription. And once you have sleep apnea rated, look at hypertension next. Oxygen drops from apneic episodes and directly spikes blood pressure, and the American Heart Association links obstructive sleep apnea to hypertension. The next two conditions are where most veterans leave the most money behind because they file one and completely skip the other. Condition 5 is limitation of flexion of the knee, or DC 5260. The max scheduler rating is 30%, worth $552.40 a month in 2026. Most veterans get stuck at 10% and never push past it. Here's the rule you need to know. 38 CFR 4.59 is painful motion principle. If it hurts to bend, the VA is required by federal law to assign the minimal compensable rating. That's not a favor, that's the regulation. The problem is most veterans push through the pain at the exam and unknowingly rate themselves lower. When the examiner measures your range of motion, stop the second you feel pain. Not when you physically can't go further. The rating is locked at the point of pain, not the point of mechanical failure. 10% is $180.42 a month, or $2,165 a year, while the 30% is $552.40 a month, which goes up to $6,629 a year. Condition 6 is paralysis of the sciatic nerve, or DC 8520. The max is 80%, which is complete paralysis, foot drops, no movement below the knee, worth $2,102.15 a month in 2026. The realistic target for most veterans is 20 to 40%, covering moderate to moderately severe incomplete paralysis. The connection the VA will never make for you, a herniated disc or knee condition presses on the nerve fires pain down the leg, and that leg pain is a completely separate rateable condition. File it as a secondary claim to your back or your knee. At the exam, tell the examiner exactly where the pain travels. Down the leg, into the foot, into the toes. Nerve distribution is specific, and the more precisely you describe it, the harder it becomes for the rater to deny the connection. Condition 7 is the lumbar spine, or DC 5237. The true max is 100%. This is complete unfavorable ankylosis of the entire spine, but the realistic range of motion based target most veterans are fighting for is 40%, which requires forward flexion of the thoracolumbar spine to 30 degrees or less. That pays $795.84 a month in 2026. Most veterans land here at 10%, which is $180.42 a month, or $2,165.04 a year. The 20% threshold is $356.66 a month, or $4,279.92 a year. It's right there, and they walk right past it because of what happens in the exam room. Same rule applies here as the knee, 38 CFR 4.59. Stop the moment you feel pain. Not when your back locks up, not when you can't physically go further. Pain is the measurement point, and most veterans push through it and rate themselves lower without even realizing it. Stop at pain every time. You now have the 2026 max pay figures for the 7 most filed conditions in the country. And if you like this kind of video and you like this content, make sure to like and subscribe so you don't miss the next one. And make sure to leave a comment on anything or any video you want to see us make next. And if you need help with your VA disability rating, make sure to check out VetClaims.ai, and we have a link to that in the description below.